the veganism, as you know, is the practice of abstaining from the use of animal products. And the wider philosophy is just not to hurt any living beings and respect all the living beings. I became vegan for the three reasons. Ethical, which I have talked about in my last interview, environment, at the moment to alleviate the world's hunger. The veganism is the way forward. And the third thing is the health benefits. And even if you are selfish enough not to think about the ethical and environmental reasons, veganism is a way forward for the health benefits. As you know, I'm just supposed to be, this is a diabetes chai chat. So I just want to start telling what does the diabetes means. The diabetes in the Greek word means, diabetes means pass through or a siphon through, and the mellitus means sweet. So before all these interventions, the predecessors, how they found that somebody had a diabetes? By checking their urine or tasting their urine, which was very sweet. So basically, as you know, diabetes is the metabolic disease, which there is a dysregulation of the sugar metabolism. The insulin is produced by the pancreas. And in the diabetes, either its pancreas is not making enough insulin or body is resistant to the insulin. So that's basically a real difference between type 1 and type 2. Type 2 diabetes is a lifestyle disease. When there is a insulin resistance or body becomes resistant to the effect of insulin. While type 1 diabetes is a bit of autoimmune, genetic and environmental factors both play a part. The type 2 diabetes is called the Black Death of the 21st century. The pathogenic agents are high fat and high calorie diet, and not to mention the lifestyle, sedentary lifestyle. Instead of fleas and rodents, the causes are advertisement and inducement of poor lifestyle. So I just want to mention a little bit, what is insulin resistance? As you know, the carbohydrates are broken down into the simple sugar or a glucose, which enters into your cell. And for cell, basically you need a glucose for it to work. But the insulin almost works as a lock. It opens the door for the glucose to enter the cell. Now, what the high fat diet does is gums up that lock, so the insulin doesn't work. That's called insulin resistance. Type 2 diabetes is 90% of it is a lifestyle related, and 90% of the people with the type 2 diabetes are either overweight or obese. So carrying excess body fat is #1 risk factor for type 2 diabetes. 90% of the people who develop type 2 diabetes are overweight. So what happens to the overweight people? The number of fat cells don't change. But the people who have excess fat consumption, the fat cells start swelling up. When they swell to a certain level, there is a spilling of it spills into the bloodstream, and then they have a insulin resistance or a clogging of the insulin effect. As fat levels rises, your ability to clear the sugar from the blood goes down as well. In California, the people who were flexitarians, who ate meat once a week, their diabetes, they could reverse to by 28% or in remission. Pescatarians who ate fish, they could cut down by 50%, vegetarians 61%, and the vegans who didn't eat any meat or dairy products, they could reverse the diabetes to up to a 78%. The reason for that is the animal fat. Animal fat is a high in a saturated fat. Palmitate, which is a saturated fat, which comes from the meat, dairy, and eggs. And the monosaturated fat, which comes from the nuts, olives, or avocados, it's a good fat. They could be detoxified and then stored away, as opposed to the unsaturated fats either clogs the arteries and cause the atherosclerosis or causes insulin resistance, which makes us insensitive to insulin, and you end up becoming diabetic. So eating plant-based diet, it's a better insulin sensitivity, better blood glucose control, better insulin level, and better beta cell function. In other words, eating plant-based diets appear to be better at both producing and using insulin. So not only your beta cells becomes more productive, but and then you have got a better sensitivity. So when I was in my medical school, I was given this book by my dad. It's Dr. Siegel's Natural Fiber and Permanent Weight Loss. Basically, it's eating fiber and lose weight. Now, for that, the reducing belly fat is more important than just overall. So, in other words, fat distribution is important. So, apple-shaped or a pot belly is the worst predictor of the diabetes to come. And so far, the management of the diabetes, particularly type 2 diabetes, is with reducing sugar or the medications. But the emerging newer thinking is about pathogenesis of the diabetes. In the pathogenesis is low level of chronic inflammation, which is responsible for diabetes in multiple ways. It can cause insulin resistance, affect metabolism, favoring processed foods into fats, and it destroys insulin producing cells in pancreas. While there are many reasons for chronic inflammation other than the diet, such as the poor sleep and stress, the dysbiosis of the gut microbes, collective ensemble of microbes in the digestive system, plays a huge role. The dysbiosis here simply means deviation from the healthy balance of different bacteria, or so-called friendly bacteria. As you know, our body, we are 4 or 5 pounds of our weight is purely these bacteria. When the population of the bad microbes increases, it leads to endotoxemia, and which causes the inflammation and the metabolic process, and eventually it leads to the diabetes. So therapeutic goal is using food. Therapeutic goal of the food is to food intervention is to maximize the population of the good bacteria and reduce the population of the bad bacteria. And then comes this concept of prebiotics and probiotics. Prebiotics are the thing which feeds to probiotics. Probiotics are basically lactobacilli, which are a good bacteria, which you can find in the yogurt or a fermented food, plus a lot of other the plant-based vegetables, and which are very good for the healthy gut, which makes the insulin sensitivity much better. So while many people are aware of the probiotics, few people are aware of prebiotics. Prebiotics are the food that are more potent than the probiotics. And the whole plant-based diet contains many things which feeds these probiotics or a good bacteria. The other thing about the carbohydrates and the plant-based diet, there are complex carbohydrates, which are, some has got a glucose, some has a fructose, some has a maltose. So cutting down all carbs from the food is not a good idea. But try to have a complex carbohydrate which are releasing sugar slowly. And with the vegan diet, for the protein content, if you are having the different beans, legumes, on a rotational effect, you get a different amino acids from all the beans and the legumes, and you are not likely to suffer nutritionally. And the same way with the carbohydrate. Rather than just, as you know, the most common thing which is used for the overweight or the obese people is body mass index. But more than important than body mass index is the waist to height ratio. Because as I mentioned, pot belly or the central distribution of the fat, which means a visceral fat, is not very good, or it is basically a precursor of the metabolic syndrome or the diabetes. In the 30, 40 years ago, in the medical school, it was all about infectious disease. We have cleared the infectious disease with the better hygiene, vaccines, and the medication. But the new thing is a non-communicable disease. That is diabetes, high blood pressure, high cholesterol, metabolic syndrome, stroke, and the disease related to our new lifestyle. The changing nature of the disease pattern now requires more emphasis on the prevention and the lifestyle changes. And so changing nature of disease pattern now requires more emphasis on prevention and lifestyle change. And the lifestyle change, in my opinion, the most important thing is the plant-based, whole plant-based, non-processed food, and increasing activity, minimum 30 minutes to 1 hour of physical activity. Thank you.